Facial pain primarily when it starts off over here and radiates, and sometimes you chew and it makes things worse. So the jaw, the bottom of the jaw, the mandible is what we call it. It's attached to the rest of the skull along these two sides, and you've got a disc right over there. So if your jaw gets damaged or the disc gets damaged, you start having pain every single time you chew. So if you're chewing something hard, if you're opening your mouth for a large burger, all that contributes to the pain being worse. What's interesting is you don't have a very specific or a common pain pattern when it comes to the head and neck pain. So you may have pain radiating only along to the bottom of the jaw. You might have it radiating to the head. You might have somewhat of a trigeminal neuralgia picture where you've got pain going along specific VU2, V3 nerves, but essentially is coming in from that TMJ, which is why we do diagnostic injections or therapeutic injections. The diagnostic injection is to diagnose what exactly is going on, and a therapeutic injection is to reduce the inflammation and go after the cause of the pain. And in some cases, we'll do diagnostic and therapeutic injections where we're getting the information, but also treating it with a single injection. So headache is a completely different realm where people who have headaches, let's say more than 15 days a month, are truly struggling. People who have migraine headaches, it's excruciating. It stops you from doing anything. You're sitting in a dark room, you don't want to do anything, you don't want to deal with anyone. And people don't realize the intensity and how debilitating it is to have a migraine headache. And anything can trigger it, let it be food, change in temperature. There are a lot of different aspects, including stress, that can contribute to a triggering of a migraine headache. So we do head and neck injections, we do Botox injections for migraine headache, and that helps reduce the exacerbation or the intensity of when you have the pain and the frequency also. I had a patient today who I've been seeing for about 2 months. They've had pain going from their TMJ to the head all the way to the back of their spine. And the question was, where is the pain coming from? So we did one injection. It was a TMJ injection. It was diagnostic, therapeutic. It's been about 2 months and the patient is relatively pain-free. His pain scale went from 10 out of 10 to 2 out of 10. And this is someone who was suffering for over 5 years, has gone through multiple different doctors, multiple different approaches to tackle his pain. And there were a lot of red herrings where you look at the spine and you think there's a disc herniation and that's what's causing the pain. But if you look at folks who have no back pain above the age of 30, a vast majority of them have disc herniations and disc bulges, which is why I call them red herring, because you start focusing on the image without looking at where the pain is coming from, or listening to the patient and doing an examination. And I think that will help guide things a little bit better. So even if you've had treatments before where you did not get significant relief, it's worth dropping in and getting a second opinion on it, because we may be able to help you.